to please come here and deliver his address. Sir.
Good evening, respected DGRHS Dr. Prasad, respected CMD Eastern Railway Dr. Pudlakoti, all the senior doctors from Eastern Railway, South Eastern Railway, and all my friends. I presume they are all my friends. I have a very pleasant task of presenting South Eastern Railway once again to our DGRHS who knows it inside out, and to those who don't know South Eastern Railway. This is a presentation made by our doctors. Incidentally, we have got inputs from all the divisions also, because for the first time this year during CMD's level presentation of awards, Railway Week awards, we had decided that we will have the presentation of the activity of each and every division to be presented by the respective CMSs here for all the other divisions to see and emulate if there was something worth emulating. So this presentation is based on a compilation of that, so please bear with me. For those of you who might come to Southeastern sometimes in the future, this would be a very good, knowledgeable introduction to Southeastern. So with your permission, may I start, sir?
Yes.
This is the statistical details of Southeastern Railway. Although we are not officially recognized, Southeastern has got certain distress areas, and definitely if rationality was the criteria, should have been declared to be eligible for distress allowance like the NF railway areas are. Example, Chakradharpur as well as Ranchi division and Adra division. We talk about Maoist problems. All the three areas are areas which are infested with the Maoist fighters. I am not going into the details of the locations and the difficulties faced by the members of our fraternity. It is a tremendous task, especially in the present age of ever increasing beneficiaries, and it is only the team which keeps the work going. These are our hospitals, the divisional headquarter hospitals. Might be remembering, sir, we have got the Adra hospital, the Kharagpur hospital, we have the Chakradharpur hospital. Of course, shortly this is going to undergo a change within the next 1 or 2 years when the new building comes up, and that is the latest addition to the hospital chain on Southeastern. It has been given a name also. For the first time our hospitals have got a name, and that is Sanjeevani, the Ranchi Divisional Hospital, which is still under construction. They have already got 25 beds and they are doing excellent work with only 8 doctors on the roll. Of course, in the center is the referral place for all these hospitals, that is this very hospital, Central Hospital. This is the statistical once again position, and as of now we once again have only 29 contract medical practitioners, but then I am told in other railways the number of CMPs is much more. That way we are possibly fortunate, but then our geographic and locations are such that even CMPs are not willing to go and work there. The paramedics, of course, the better position because of the recruitment through the RRBs, and we are with RRB as well as contractual, we somehow try to make up the deficit. There is some good news which we gathered recently after this drive of Group D employees which was conducted about a month or a month and a half back, where more than 5,000 Group D employees were recruited. It seems the administration has agreed to give about 120 Group D posts to the medical department. We have to decide where we would like to utilize them. This is a place where we would need the help of our DGRHS. Although we are among the blue chip railways, which contributes, I think, more than 1/3 of the earnings of Indian Railways. When it comes to getting back something for its employees, the Railway Board is quite miserly as far as giving of grants is concerned to Southeastern Railway. I think we have some good news from our DG when he addresses us. What are our deficiencies, our constraints and our limitations? Whatever may be there, but the spirit of our doctors and our team, that is the paramedics, cannot be dampened with whatever constraints are there. We try our best to give out our best to satisfy our patients. just to quote from the scriptures. The clinical services, so I'll just rush through it. What we have again stressed this time with the help of our CMSs in the divisions is the multi-purpose health drive. And here I must give credit to Kharagpur for having done a very significant number of multi-purpose health drive where we are reaching out to the beneficiaries in the workshops, in the sheds, in the offices, and even in the colonies, in wayside stations. Ranchi and Kharagpur have done yeoman service in this, and I must compliment them. And this is another thing which we are trying to bring up, and that is visibility of healthcare services. Visibility of healthcare services only happens when you reach out and give the services at their doorstep, even if it's just a screening, awareness campaign, or a regular checkup. The multipurpose health drive camps of Kharagpur, of Ranchi, and of Agra, CKP has also done. They have taken up another aspect, and that is involving the community in the sanitation of the colonies. Blood donation camps have been organized by Garden Reach, by Kharagpur, and also by Ranchi, even in Maoist-infected places like Bano. Compliments to the team of Ranchi who have done it with a lot of courage and efficiency. This is the community service. You keep on reading in the papers about CSR. This is a part of CSR that South Eastern Railway has been doing in the form of free IOL surgery at Ramakrishna Mission, Kamarpukur, and also community health checkup camps in association with Rotary Club in the peripheral areas of this metropolitan city. This was a new novel idea which we started during the severe heat wave that hit Kolkata a couple of months back, and our team was at Howrah station rendering care to the passengers. And I must mention that there are quite a number of them who were really on the verge of collapsing, and this was appreciated by the press and by the public in general. We also have our St. John's ambulance services regularly. Durga Puja, of course, is a common factor where our friends from Metro Railway keep on seeking our assistance to man their stations. This is our academic excellence of our members. Dr. Jha, Cardiology Conference in Paris. Dr. Patnaik participated in as a faculty at Colombo and again at Istanbul. Dr. Basurai visited Dubai. We were told for a conference, but that was in addition to what he did. So he presented in the conference and also visited Dubai. And Dr. Muhammad Sharma and Dr. Anjana Malhotra published their research work in peer-reviewed journals. Dr. Bhuiya demonstrated live phacoemulsification surgery at Indira Gandhi Memorial Hospital, Agartala, Tripura. Even Dr. Malhotra has been on the faculty of demonstrative surgery in the Association of Surgeons of India national conferences. It's a matter of pride for this hospital. Dr. Dhanwar, our microbiologist, received the Railway Board Award this year. And I must thank our Director General for having accepted our recommendation. Our academic activities through the week here and in the divisions is mentioned here. We observe these special days, and this year World Health Day was nominated as a day for fighting hypertension, and you'll be happy to know all the divisions took up the cause, and for 1 week starting from World Health Day, there was free blood pressure checkup camps in all the divisions, even in our hospital, even in the health units. Anybody could just walk in and check their blood pressure and get it noted. We had health awareness drives in the form of route marches. Here in Garden Reach, you can see a general manager and the first lady. It was done in the divisions also at Agra, even at Kharagpur, and it was quite impressive, and I'm sure it has reached to the public. In Ranchi, they are doing a lot of good work with the society. The picture you see below here with the mothers with their babies in their lap has got a significance. You'll be surprised to know Ranchi Hospital, which has got only 25 beds and 8 doctors on its roll, has already had 25 deliveries, 6 cesarean sections. And I must compliment the Divisional Railway Manager of Ranchi, Mr. Malia, who decided to hold a special day where he would call all those babies who were born in that hospital, the 25 babies, and they were felicitated, and the hospital celebrated their birth in the hospital. It was a wonderful gesture, and the staff definitely got a lot of impetus after that event. Our training and teaching in this hospital has been very successful, all thanks to the faculty members who, in spite of their busy schedules, do take a lot of interest in teaching. Our surgical medicine as well as gynae-obs result this year has been 100%. 2 from the first 2 subjects and 1 from gynae-obstetrics have cleared their DNB in the first attempt. Congratulations to the students as well as the teachers. We are undertaking modernization of the various units. The ICCU is presently under modernization after a gap of about 20 years. Modernization or renovation has been undertaken. The radiology unit, it is almost complete. Pathology department also in phases is being completed. Eye surgery theatre was inaugurated today, you have seen. We have got the cabins in the present building which are undergoing renovation, and new 6 cabins are coming up on the 5th floor, out of which 4 have been completed, 2 more are under construction. Because of the increased number of beneficiaries and the preference that, this is not blaming or casting aspersions on any other railway. Officers of Eastern and Metro Railway prefer to get treated in this hospital. Our need for cabins has increased. Please, once again I mention, I'm not blaming anybody or casting aspersions on the expertise of any other hospital. But there is a preference, maybe because of the locale and the ambience of the area. So our demand for cabins is so high that the medical director is always in a quandary in allotment of cabins. So we had to have some more cabins. Our previous general manager agreed for that, and 6 more cabins are coming up with a beautiful river view. The Advanced Kidney Care Center, under the guidance of our present medical director, has been doing excellent service. There are almost 10 machines running continuously from morning till night, and the number of beneficiaries is not as restricted to Southeastern Railway only. They are from Southeastern, Eastern, even far off places like East Central Railway. They are also coming here. Even from NF Railway, they are also coming here for dialysis. But this would bring us to a very important aspect which I would discuss when our Director General addresses us, whether we could think of outsourcing this to the peripheral areas, because the coming and going of these patients is quite cumbersome and maybe very painful for the patients to travel the distance to undertake the dialysis. With the cost undertaken in our hospital would be almost similar to the cost the railway would have to pay to a peripheral center where they could get their dialysis done. It requires a little bit of thought, exploration, so that it can be implemented subsequently. The cardiology department has been doing a lot of pacemaker implantations and also echocardiography. The promptness with which treatment and investigations are done is definitely appreciable. This is the details of what they have done during the last year. This was something we started for the first time in a government hospital in Eastern India. The first cochlear implant was done. It is the next cochlear implant is in line and it is being processed. Shortly, within a month or 2, we should be able to do it here once again in the hospital. Department of Radiology has been upgraded with a very powerful machine, and we have started our ERCP also because of this machine being installed in our hospital, and our endoscopic specialist has already done 3 ERCPs with the help of this new machine. These are details of the X-ray plant that has been installed in our hospital. This is the new addition. The bone mineral densitometry is being done in the hospital. Ophthalmology, of course, you have gone through it. There are a few details of the facilities available in the hospital. And once again, I would like to mention something very sensitive. People who are doing their DNBs in other hospitals prefer to come to our hospital and do honorary residency to pick up the surgical skills. That is definitely something which we should feel proud of. Although we haven't started our DNB in ophthalmology, DNB candidates who have passed out from other institutions do seek honorary residency in our hospital to brush up their surgeries or pick up their surgeries. Pathology also is a full-fledged department with microbiology, and they are doing a lot of investigations. Of course, the constraints are there. Anesthesiology is the department which runs with the least number of persons. We always depend on outsourcing it on a daily basis, because on a regular basis we have failed to get on a work charge post or even a CMP. So we have to depend on per case basis anesthesiologists almost 6 days a week. There is some good news. Maybe we'll be getting our fresh ADMO in the next 2 weeks, but there is a addendum to it. We'll be losing one of our anesthetists within the next 3 weeks. Our casualty has been modernized and it was inaugurated by our Honorable CRB. It is now prepared to deal with all emergencies in diagnosis, in basic treatment. Department of Psychiatry also is doing a lot of good work in the entire Southeastern Railway. There is only one psychiatrist and he receives a lot of referred cases and has to tackle them. Gynecology and obstetrics is equally busy. We have taken a lot of upgradation in the department in the form of endoscopy, colposcopy, thermal balloon ablation, and then hysteroscope, operative hysteroscope, and they are almost adapting this as an in-house technique subsequently. The orthopedics department is novel here because it runs with one orthopedic surgeon. He is 365 days on call for emergencies, orthopedic emergencies. And the surgeries also, when he is lucky, he has his house staff. When he is not lucky, he has to borrow house staff. In spite of that, he has been doing a lot of good work. Total knee replacement was started. We are waiting for the next because the official materials that he has intended for has not arrived. So once he gets that, he will be doing further knee replacements. Of course, the patients also have to come. Joint arthroscopy unit has also been set up for diagnostic and therapeutic surgeries. Endoscopy, one of our surgeons has adopted this and is doing excellent work. And we assure him that shortly we will be replacing the defective ones. We must compliment that he has started his ERCP successfully. 3 cases have been successfully done. And we hope we don't have to refer cases outside for ERCP in the future. Surgery is one of our places. I have mentioned our surgeons are called by the ASI, the Association of Surgeons of India, for demonstration during their national conferences. Patients come not only from this railway but from neighboring railways also for plastic surgery, for onco-surgery and also for laparoscopic surgery. The list itself is self-explanatory. We have the advantage of having an onco-surgery and a reconstructive surgery at the same sitting. The plastic surgery unit has been further unique in having the Operation Smile event conducted in the hospital for the last 3 years. This year was the 3rd year and the number of surgeries performed was very significant, more than 100. And for 3 to 4 days, the entire team of Smile organization, they were here in the hospital and they conducted the surgeries successfully. Our future plans, the first is the CT MRI complex through PPP model. Our modular operation theatre, the CSSD, the upgraded SICU also is in it, and DNB course in subjects which we have assisted other hospitals in getting their DNB. Somehow realization has dawned on our doctors now to start DNB in their own courses, in their own subjects. Anesthesiology and ophthalmology have suddenly realized that in addition to helping other hospitals in getting their DNB recognized, they should also start their own DNBs in this hospital. That, in a very small nutshell, is what this hospital has been doing and plans to do. In the future plan, the wall mount oxygen supply, that is pipeline supply, we had an AC ambulance. We want to fix up another one with an AC ambulance. BiPAP ventilators are available in the hospital. Now, as per the Railway Board's directive, we are making them available to patients also. The process is undergoing with the help of Dr. Shyam Sundar and their pulmonologist. We have recently held a medical board to certify the essentiality of the BiPAP. We have, in spite of being such a big hospital, we have got only 4 bedded mortuary, air-conditioned mortuary, that is a refrigerated mortuary. We want to enhance it. And the gynae department, of course, wants to have their facilities for assisted reproductive procedure in the gynae so that we don't have to refer the cases outside. And total hip replacement in orthopedics. Thank you.